Hey guys, welcome back to my channel. Today we are talking about cancer. With me here is my friend. Please introduce yourself.
Hi guys, my name is Chile. My colleagues at times call me Emily. Today I'm here with my beautiful friend Janet to talk about cancer and the other side of cancer that most of us don't see that is very important too.
Yeah. So this video we're going to focus on uh, you as the caregiver of a cancer patient. Because we're always focusing on the patient with cancer because truly it's all about them. But what we rarely speak about is the caregiver. What you can do to make sure you don't get burnt out because it's really, really easy to get burnt out. So we're going to talk about some few things related to that. So first thing we're going to discuss is getting the news.
Yes.
Um, what was it like for you getting news of your mom?
Um, hmm. Oh my goodness. I think most times for me that news came out of the blues from nowhere. It's the least expected diagnosis to that you could even ever imagine. Um, because more for in my own case, and I believe in most cases, 80% of people with cancer, at times you might go in for something you think is a minor thing. Probably you're having constipation, probably you having pain, and you think, oh, maybe I'm just having pain, maybe it's just muscle pain, maybe it's just constipation. Only for you to go there and you get a very huge diagnosis. And that is a mind-blowing time. It's a breathtaking moment.
Yeah.
It really is a very, very good time. I wouldn't even call it a good. At that time, you don't even know what to expect. Um, in fact, it looks like the world is about to collapse. That's the word I will use.
Yeah.
You feel like your world just shattered.
Shattered. Yeah. I agree. We got the diagnosis for my mom. My mom passed away from cancer. The diagnosis came in 2015, and for somebody who's never been sick in her life, my mother was never ever sick. But one day she just wakes up and she has abdominal pain, and you know, for most people in Africa, the first thing they think of is ulcers. But she had so much abdominal pain, enough for her to complain about it. So then I'm like, okay, something is wrong here. And the pain got so bad that I'm told, because my mom was in Kenya and I'm told that there were times that she was just crawling on the floor because of so much pain. So then the next thing you want to do is send them in to the doctors to have something checked, which brings us to confirming the diagnosis. And when finally the diagnosis is confirmed, they do a bunch of tests, a bunch of imaging, CT scans, MRI, ultrasounds, and then they come and tell you, you have cancer. Oh my God. It's like somebody just gut punched you. Somebody just like pulled a rug from underneath you. Like you said, your
I'm
world
glad we're laughing at
shattered.
it. It's not funny at all.
It's not funny when you're
Oh,
getting the
it is
diagnosis.
that funny.
Yeah, yeah. It's not funny that now we can laugh. And um, Sheila's mom is here in the States, so she's able to see her and was able to be with her step by step. And I was in the States, and my mom was in Kenya. And when we got the diagnosis for me, the funny thing is I was at work. I had just started a new contract. It was on my second day. So when they went to Nairobi Hospital, they confirmed the diagnosis and said she has cancer everywhere in the stomach. I quit.
Of course, yes, exactly. When my mom was diagnosed, it was a Saturday after Thanksgiving. Thanksgiving was on a Thursday,
Yeah.
and I noticed the changes. She looks a little different.
Yeah.
Um, stomach so distended on Thanksgiving Day because we had a little party. So, and I'm like, immediately I walked in, I said, "Oh, mommy, you look so different. What, you don't look like yourself." And that is the most important thing for most of us. We have to be able to. It is. I'll say when you having that bond with your family is very important because when you know exactly what your family member looks like, the things they like,
Yeah.
it gives you a lot more advantage
Yes.
to notice when things are going wrong.
Yeah. Yeah.
We have to be able to know our family members very well
Yes.
and insist when you think something is going wrong. Most times they will not know. Like my mom's case, my mom didn't see anything wrong with herself. She thinks she's okay. And it's a Thanksgiving Day, merriment. It's all about being happy. It's all about Thanksgiving.
Yeah.
But at that moment, I was able to step back and say, "Hey, mommy, you don't look good." She argued with me for a while, and like, "Oh, you're always looking at me." Yeah, what else do I have to do than to take care of my mother? So, I always look at her.
Yeah. Yeah.
So I told her, "Say, mommy, today is different," and we argued over it on Thursday, Thanksgiving. Friday, I went back, "Mommy, your stomach doesn't look good." Fortunately enough, I am a registered nurse, so I was able to differentiate a normal abdominal distension from constipation. Most of us will feel, "Oh, we're constipated, we're bloated, it's
Yeah.
air."
Yeah.
But I tell you, when you find a green vein on your stomach, that means something serious. The green veins are your mesenteric veins. They just don't pop out. They pop out because something is not going right.
Yes.
Mostly because you have obstruction
Yes.
or you have a growth in there that is not supposed to be there. So your veins are being pushed out. So most times is before you can have just regular constipation to pop up your mesenteric veins, that means that constipation have probably blocked in there to be impacted.
Yeah.
So when I look at her on Friday, I notice it's not just this section. My mom is a little bit light, in color. So I was able to see the green veins clearly. So I'm like, "Oh, mommy, that doesn't look right. Let me listen with a stethoscope." But anyway, if you're not a nurse, you don't have a stethoscope at home.
Yeah.
When you look at your loved ones, if your mind, you have that intuition, your mind will, your inner self will tell you this is not normal. There's nothing wrong in checking things out. Don't look back. Don't sit back and say, "Oh, it's nothing," which most of us from the under developed countries, we tend to undermine a lot of stuff.
Yeah.
But when it comes to health issues, especially with cancer,
Yeah.
the faster you run,
Yeah.
the better.
Yeah.
But anyway, at the beginning, you might not know it's cancer, but I'll
Yeah.
tell you, it's still always,
Yeah.
always good to listen to your inner self
Yeah.
and insist that they go check out.
Yes.
If it's nothing, good enough, you go back home.
Yeah. And guys, we'll talk about different cancers in another video, but you remind me the number one telltale signs that something is wrong that is cancerish is weight loss. If your loved one has lost more than 30 pounds or 14 kilos,
Okay, yeah,
unintentionally, not somebody
unintentional
who is intentionally trying to
to
lose
lose
weight
weight.
or intentionally doing something to make them look like unintentionally out of the blues, the weight loss just keep coming, and it's say over the last 3 months, 4 months, 5 months, 6 months, and they've lost more than 30 pounds, and maybe now at this point the appetite is not as good. That right there should tell you to get them checked out. So when I got the news for my mom, I quit my job right away and I caught the next flight to Kenya, and I came over just to be with them. So they get the testing and everything is done. And then the next thing they do is to start the treatment. So for you as a person, like for me, I was so confused this whole time. Yes, I'm a nurse and I'm knowledgeable and everything, but it's different when it's your loved one.
Yes.
It's very different when it's your
Yeah,
loved one.
being at the other side of
Yes.
care
Yeah.
is way different. I remember when my mom went in, when
Yeah.
I finally convinced her
Yeah.
to go get checked out. So
Yeah.
Saturday morning, I was so disturbed that I couldn't go to work.
Yeah.
From that Thursday that I set my eyes on her,
Yeah.
I couldn't step out of the house. I bent on talking to her to go get checked out.
Yeah.
Friday, I called her from work, talk, and she's like, I'm not going anywhere.
Yeah.
But I woke up Saturday 5 a.m. and went back to her room and said, Mommy, I don't feel good. I am not leaving the house
Yeah.
if I don't get you checked out. That's
Yes.
the only peace I will have.
Yeah.
Okay, just do it for my sake so
Yeah.
that my mind can be at peace.
Yes.
And she listened. So we left the house probably around 8:30 a.m.
Yeah.
Um, and they did a ultrasound.
Yeah.
And just because we were thinking is maybe constipation.
Yeah.
They did ultrasound and it doesn't look right.
Yeah.
There was a lot of
Yeah.
fluid,
Yeah.
and it looks like malignant. They have to go for a CAT scan.
Mm.
And that's when it started from their admission. And I'm looking at apparently the hospital we went to, I just finished a contract with them.
Mm-hmm.
The doctor that the guy had diagnosed was just my good doctor that I work with.
Yeah.
And me sitting back, staying on the patient side,
Mm-hmm.
and he looks, I think, so devastating.
Mm-hmm.
That's when you realize that
Oh.
we caregivers,
Yeah.
healthcare workers,
Yeah.
I think it's more painful when you know much
Yeah. Yes,
than when you
yes,
don't
yes.
know.
I was thinking the same thing, that being in healthcare can be a blessing and a curse at the
Okay,
same time,
yes.
because you know too much.
Okay, exactly.
Yeah.
In my own case,
Yeah.
to an extent, it's a blessing
Right.
when we actually start moving down
Towards
to the treatment and
treatment
all
and
the.
yeah.
But at the beginning,
Yeah.
I'm not gonna say it's a blessing
Yeah.
because I think it took my breath away.
Yeah. Yeah.
I couldn't find my breath.
Yeah.
I was just like already dead. I think
Yeah.
I died before my mother,
Yeah. Oh.
even though I pretended like
Yeah.
tried to give her like that look of it's gonna be okay.
Yeah.
But within me,
Yeah.
I'll go behind doors and I
Yeah.
cry.
Yeah.
I get back home the next day. I told my agents, and I'm like, I'm not picking up any contract. I'm
Yeah.
done with the job.
Yeah.
In school, I was in school.
Mm-hmm.
I had to. I at first I was like in denial.
Mm-hmm.
Let me
Mm-hmm.
go ahead and see. I can still carry on with my school since I'm
Yeah.
not going to work.
Yeah.
To be honest with you, the emotional trauma
Yeah.
is a whole lot.
Yeah. There's so
That
much.
was a whole lot. I
Yeah.
couldn't concentrate. I
Yeah.
will get in front of a book. I end up crying,
Yeah.
not even paying. I can't concentrate on one thing.
Yeah.
I started owing backlog of homeworks
Yeah.
for 2 3 weeks,
Yeah.
and then I summoned courage to say, you know what, I have to let them know
Yeah.
I'm gonna withdraw. Instead of I don't want to
Yeah.
have a bad record in school, I'm just gonna drop the class before it gets late. It was
Mm-hmm.
2 days before the drop date,
Mm-hmm.
so I had to drop. School cancelled,
Mm-hmm.
work cancelled,
Because
full time
now
at bedside.
100% attention now
Attention,
to the sick one.
sick one.
Yeah. Yeah.
So the life around a loved one
Yeah.
just stopped right
Yeah.
there.
Yeah. Yeah.
Abruptly, you have like a stop in everything you do.
Yeah. When you are the primary caregiver, and you've gotten that cancer diagnosis, you completely neglect everything. Like you're saying, you
Yes,
quit school, you quit work so that you can give your mom 100% of the concentration and
session.
attention. And I did the same thing. And like you, I also cried. Like literally, when you confirm the diagnosis, you get diagnosis, I cried like a colicky baby. I cried so hard, and that crying before I got on my flight like gave me the strength to be able to focus and be strong for them,
Be strong.
because I can't be going there and crying all over her, when she's sick, because you're gonna make them like lose hope and things like that. And plus, me being the firstborn in my family, I have to be strong for my siblings as well. And so after all the imaging, you do a lot of blood works, you do your cancer labs, your CBCs, BMPs, so many testings. And then you do a bunch of imaging, ultrasounds, EKGs, MRIs, CT scans, so many different things. And you're having so many consultations from oncology, radiation therapists, your regular doctors, your heart doctor, depending on what's going on, and then they start treatment. But you realize that as a caretaker, now you're consumed completely by this loved one. You're not taking breaks, you're not eating, you're
That,
not thinking straight.
that's all you do. You
Yeah.
can't even remember to drink because you have no appetite. You've
Yeah.
lost appetite.
Yes, yes. You lose appetite
Yes.
completely.
You
I lost
then
appetite completely. I
you
lost
can.
weight.
Oh
Yeah.
yes.
Yeah. Yeah.
you look sick yourself.
You look sick yourself.
Yeah.
So what's important? What was important for you during this time? What could your family or friends done to support you during this time to avoid burnout?
Um,
Or what
be
did they do?
I'm gonna say it's always better when you have big families.
Yes.
In my own case, I am the only child with my mom in the United States.
A
So,
spoiled brat.
yes, I'm a spoiled brat,
Uh-huh.
So, this time is a lot more harder for me.
Yeah. Yeah.
And also a healthcare giver. I'm a healthcare worker. Being a nurse, I tend to anticipate what next, and in a good way, the benefits, it kept me on my feet. I was able to plan ahead of time. I was able to make sure I get this done, get that done, remind the doctors to do this. You know, healthcare workers are the worst patients because we want everything done right
Yes.
now.
Yes.
So yes, yes, I am that kind of person.
Yeah.
I literally was just right at the bedside. I most times when people have diagnosis of cancer, they do the biopsy, they let them go home and wait for the result. I refused to go home.
Yeah. Yeah.
I insisted on staying right there.
Because you want the treatment started right away.
Right away. I did not go home. I refused to take my mom home. So
Yeah.
we stayed in the hospital on admission till the biopsy result was out for like 7 days afterwards. So for my mom is a teacher, and when she moved down here, she continued teaching. She teach American history for citizenship classes. So she have very good support with her students. She's a chaplain in a ministry. So the church group where they came immediately. I happen to be a member of the ministry too, and so immediately I called the I'll say the head ministers, the evangelists and all of them. So I called them and I said, hey, immediately while we were in the hospital, right even in the emergency room, I called them. I said, this is what my mom is in the emergency and this is what we're going through. So most of our support system and our came from the church, So they were calling every day, every minute. They call me, they ask me, what do I need? It's all about, do I need finance? They were very, very helpful.
Yeah.
Prayers, everybody, it was like an intense prayer.
Yeah.
Every minute there's a prayer going on. My mom is a very, very religious woman. So that gave her much hope. And that worked a whole lot because the minute the diagnosis was confirmed, the first thing I realized was the psychological trauma.
Yeah.
The changes, she immediately, this is a woman that never believed she was sick when we got in.
Yeah.
But during just the 7 days of diagnosis, she changed. And then she looked really, really sick.
Yeah, so like the news comes as a shock.
The news comes with a shock.
Yeah.
And the psychological trauma drains everything. And you look at the patient, you can then start seeing the exact features of a cancer patient.
Yeah, yeah.
But with the supports that you give them, they tend to get much courage.
Yeah.
So we had the church group. I think they gave us a lot more courage, the support that we needed to get ready for what is ahead of us. And they walked through those battles, those journeys. They were there every minute, every 24 hours a day. They were there. So having close supports, I think, means a lot. It takes a lot. It makes you have hope. It takes away the despair that something bad is about to happen. It gives you hope and courage to keep fighting. Like you know where you're heading to.
Yeah.
So when we get that courage, that support, and a lot more family members too. Most of our family members, I would say extended family members
Yeah.
and family friends,
Yeah.
not really close family members though. But everybody was calling in to show their concern and prayers.
Yeah.
A lot of advices though. I'll tell you, a lot of advices. Some of them
Yeah.
makes no sense though.
Yes, yes.
But, you know, we appreciate every advices, okay?
Lemon juice doesn't have to cure cancer.
Everybody have their own home remedy.
And everybody's already do all these things.
All home remedies, you know. So please, 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 when you're going through any ailment, you have to be able to face for those of us that are very religious, make sure you attach your faith with realities. Go through the medical treatments while you stay on your prayers. Like I always say, yes, of course, what God cannot do does not exist. But please, please, please make sure you also take treatments.
Do what your doctors are telling you to
Listen
do.
to your healthcare team, work together with them, and back it up with your prayers. And when it comes to home remedies and all the home advices you will get, please, please, please sieve through them. Make sure you are sieving through them. Not all of them are helpful. And when it comes to the cancer treatment, which we will get down there, some home remedies will hinder the effectiveness of chemotherapy. Some vitamins will make the chemotherapy not work very well. So please, please sieve through all the information that you get in.
And check with your doctor, because different cancers, different treatments, you know, but always confirm with your practitioner.
Yes, make sure you confirm with your healthcare team about any before you start any home remedy or any vitamin. Please.
In terms of support, I got my support from, so I have my church here, my Kenyan, we have like Kenyan people here. So I have my Kenyan people at large, and then we have support from my church members, which is, you know, different nationalities. So, and, you know, I go to a very small church. We're very intimate, and we are very, so everybody knows everybody. So, you know, they would come over, they call, they would text. You know, I just felt like, you know how like a mama hen covers the little chicks? You know? So I felt protected, I felt covered. They were praying, checking on me, and then once I went back home, we also had our church family back home that were coming to see my mom, coming to make sure that my siblings were okay, checking on them. All that support and financial support from loved ones. And it's really hard to like focus on you. I was gonna say like self-care. You have to sleep, you have to eat right, you have to do things for you. It's really difficult because you, especially when you are an only child, and I was a firstborn. So like the primary, say, decision maker, it's really hard to step back. But if you have that support system from your church family, from your friends, allow them. You can step back, even if you go away for an hour, go and take a walk at a nice park like this one, or just go take a nap. Just do something different. Other than looking at this patient or your loved one. It's good as a way of self-care. Make sure you're eating right. It's hard to even sleep, but try your best. Even if you're going to survive with naps, do that. Like I said, it was hard for me to eat. I was losing weight.
I tell you, it was hard for me to get a nap. I probably cry myself out to sleep. Or maybe I will go to sleep from running around, get burnt out, get to bed, and I doze off. But then something will wake me up like, get up, you need to look at your mother.
Oh my God.
So throughout the first time, I would say throughout the first month or the first 2 months, I couldn't stay anywhere away from my mother. I was sleeping right on my mom's bed. I had to like watch my mom sleep. Because every second away from her feels like
something might happen. There.
So I couldn't sleep, couldn't eat, couldn't drink. It was just all about her. I was busy researching what kind of treatment, and I know we'll get in there, choosing cares.
Yes.
I was busy researching
Yeah.
which healthcare team, which
Yes.
healthcare industry, which
Yes.
hospital will
Yes.
give us a better outcome. And then I was busy thinking about how to plan the finances. Do I actually have enough finance to carry this goal? What are my options? So throughout that first, it took like a month
Yeah.
before my mom was able to get into treatment.
Yeah.
That throughout that month, that was the longest 1 month of
Yeah.
my entire life.
Yeah.
Every day seems to be very, very long.
Yeah.
Waiting for this to be done, waiting for that to be done, for that to be done.
Yeah.
So I couldn't sleep. If I actually had to doze off
Yeah.
from exhaustion,
Yeah.
I had that moment of get up,
Yeah.
watch your mom.
Yeah.
So I just had to sit down and watch
Yeah.
her sleep.
Yeah.
And I remember one day I went to my room and I closed doors and I broke down.
Yeah.
I screamed
Yeah.
to the
Yeah.
so loud that
Yeah.
I was just like in tears. I screamed to God,
Yeah.
do not let anything happen to my mom.
Yeah.
And my mom is, I'll say, she's my guardian angel.
Yeah.
She tend to look at my face too. So when she learned that was my voice crying, because it was a loud voice of tears.
Yeah.
And she felt so bad. And she opened the door and walked up to me and she said, I'll fight for your sake. And we cried. And then because she walked in, immediately I braced up my strength and I said, oh no, mommy, I know I just broke down. I'm sorry for breaking down, but I know we will get through this.
Yeah.
And I don't want you to feel bad about it.
Yeah.
And we moved on.
Yeah.
So it's a lot more of emotional traumas.
Yeah. So
A lot of emotional traumas to go through.
Yeah.
Till you get through till you get through a certain stage where you can say, oh, now I'm accepting this.
Yes.
Before, through the first stage, is a lot of, you're in denial, you're a lot of
then you get angry.
At times you try to ask, what is this?
Yeah.
You try to ask,
Yeah.
what have I done to deserve all these traumas? But looking ahead of it, all I can say is walking ahead of time, making sure you get the things you need on time.
Yeah.
Makes a lot more better outcome. With cancer, you have to work fast. I know a lot of stuff can hinder the fastness of whatever you want to do.
Yeah.
At times it can be finances. At times it can be getting the better care team that you need.
Yeah. Yeah.
So
because I'm glad your mom was like here, and in the States we have some of the best care that anybody could ask for.
yes.
My mom was in Kenya, and she was getting pretty good care, and because she was at Nairobi Hospital, which is I would say one of the best. But the procedure that she would need was so complicated, so I looked into her coming here to get treatment. So I talked to some of my good doctors at the same hospital where you worked as well. And they were willing to accept her. But when I looked at the process of getting a visa for her to come, it was almost impossible. So then the next best thing was India. So then I looked up some of the best facilities in India, and I started the process, got the visas and everything, and we were ready to go. And then the doctors at Nairobi Hospital said she's too unstable to travel.
I got some news.
Yeah.
And that news, I tell you, is a tormented news.
Yeah.
That news will follow you everywhere.
Yeah.
Yes, it was a tough conversation I've ever had in my life.
Yeah, that's hard. That's hard.
At the beginning of the treatment with cancer, I don't think the doctors will ever give you 100% assurance.
No, they don't.
Yeah,
have it. They can't.
They cannot, because most of these cancer treatments differs from individuals. The way your body reacts to one treatment differs from the way the other person reacts to the treatment. and that happens with its effectiveness too.
Yeah.
Some people's immunities are stronger to battle with the chemo, because the chemo is a very tough drug that, as it's killing the bad cells, it's killing the good cells too. So some people they cannot take the chemo. Their body cannot handle it. And the doctors are out of options than to let nature take its course. And some people will take it and they go through it well. And in my mom's case, she's lucky. My mom took the chemo well. My mom had been through 9 cycles of chemotherapy.
Wow.
And she's still moving. The side effects, not really. I don't think she even had any. But when they break that news, telling you, I cannot assure you of anything right now, because the only news you want to hear is to hear, oh, you're gonna be fine. This will go away. We want hope.
But they can't guarantee that, So they will tell you the most devastating news is there's nothing else we can do.
Yes.
And some of them will deliver that news in terms of, hey, you have 8 months to live.
Yes,
you have 6 months to live.
You have these years to live. You have that years to live.
And like you said, there's no guarantees, because they might say you have 6 months to live and then you live 4 days.
4 days.
And sometimes they might say you have 3 months to live and you live 3 years.
Yes.
So it just depends on your body. And how it fights this cancer.
Yes. The one thing they will not give you is that you're free for that once they can cure cancer. Because at times you get lucky, you get in remission where there's no cancer cell detected in your system. There's still no answer of, oh, you are cured.
Yes.
That doesn't happen when it comes to cancer treatment. You like my mom now have no cancer cells anymore. But that does not mean that you will not hear the doctors to tell you
that, hey,
go home,
go home,
go home. Your health has been transformed.
No.
So it's always go home and continue treatment. It's always go home, continue treatment. There's no go home. You're cured.
So guys, in terms of the support you need to give to the people. So if you have a loved one or a friend who has a family member going through cancer, whether it's a spouse, a mother, a child, just be there for them. Listen to them. Some people just want to be listened to, and there are those who want to be distracted. So if you are that kind of friend who would stick around and go through tough times with your friend, then you would know what kind of things they like to do. Do they like to be distracted? Then find ways of distracting them. Would they like a break? Then you can come in and say, hey, I'll watch your mom for a couple of hours or 6 hours or whatever. Go do something else, or go do this and that. Like we mentioned, finances, it's really hard. So if you can help financially, if they need help financially and you are able to do whatever little that you can do or whatever big that you can do, definitely be there for them and support them. And if you are that close of a friend, don't ask, do you need anything? That question is so cliche, and it's so empty. Don't ask that. Just
some friends will only, they just sitting and waiting when you come to beg. Instead of being there for you. Instead of because true friends will not wait to see you cry before they know you need something. They'll be there just to make sure they prevent you from getting to that stage of crying. Support you through that. Some friends will just sit back and watch you. Well, if you ask me, true friends don't wait until their friends ask.
You show up and you are there. Like you said, at that time you were so confused, you barely even know what's good for you. You know what you want. So be there for them, support them. I remember my beloved pastor also went through cancer, and while he was getting treatment, he was getting treatment at a hospital that I knew and I worked at. So I was able to just go there and even be there. And even if, as a person, as a nurse, you are knowledgeable, right? So I was able to go there, facilitate admissions, facilitate discharge, ask, questions, what's important, break down things. Because sometimes, healthcare professionals will come and just use all this medical jargon. So we'll break it down what that means in like layman's language. And sometimes you go to a friend's house, just look at the fridge. Does it look like you need to be replenished? Okay, go buy a gallon or two of milk. Go buy some oranges. You know, don't ask what do you need, or do you need anything. If they can tell you what they need, that's fine and dandy. But if they can, just look and see what you can do. Because if this is your friend, then you know, or this is your family, then you know what they need. You're able
And
to
at
step
times
in.
it's not even about the finances.
Yeah.
At times it's like Janet and I met in our work. And when we find out that we've been through similar situations,
Yes.
because I tell you, the toughest part is watching a young parent go through heavy diagnosis.
Yeah.
So Janet and I have similar backgrounds, so it makes more sense. We get glued, we get
Yeah.
connected.
Yeah, we connected.
When we talk, because we know, and knowing that she's been through what I've been through.
Yeah.
Is
Kinda.
the trust.
Yeah.
We had so much trust
Yeah.
with
Yeah.
each other.
Yeah.
With the little time we've known each other, we feel like we can trust each other for
Yeah,
anything.
these are what we're talking about in the last video. You know, co-workers who goes ahead to become family. You know, I feel
Yes.
like, you know, you.
So we feel like we are
family.
sisters.
Yeah,
We
we're
feel
sisters now.
we'll share more than what friendship is all about.
Exactly.
So just being there, you can once you notice somebody's going through that time, and you want to be there as a friend.
Yes.
It might not be really the
Yeah.
finances.
Yeah.
You can say, oh, when do you guys go to the therapy? I want to meet you up there.
Yes. Yes.
You
yes.
go meet them up. The chemotherapy is a whole day treatment.
Yes.
You can go there just to be with them.
Yeah. Even if you're just sitting and
Sitting,
saying nothing.
yeah,
Yeah. Just
suddenly
your
saying
presence.
nothing, just
Yeah.
your presence
Yeah.
means a lot.
Yeah.
You know,
Yeah.
you don't have to spend money. You can hang around with them.
Yeah.
Give them call 1 or 2 times.
Yeah.
Make sure they are okay. If you're not able to meet them up in the centers,
Yeah.
oh, are you guys okay? What is going on right now?
Yeah.
You know, it makes a lot more. I think that support means a lot when
It
people are
means a
going through
lot. It means a lot.
a lot,
Yeah.
going through treatment.
Yeah.
And one thing that I think that helped my mom too was I created a family WhatsApp forum
Okay.
where all my siblings can chat every day.
Yeah.
So we do video call like every minute.
Yeah.
We do video call.
Yeah.
We chat
Yeah.
till today, till this moment.
Yeah.
We feel like we are together because everything, gossip, everything is in
Yeah,
the
it's in the
forum. My
WhatsApp group.
mom feels more closer to her kids.
Yeah.
So that gives her more support.
Yeah.
We pray together in the forum,
Yeah.
discuss everything in the forum.
Yeah.
So that support means a lot when you're going through cancer,
Yeah.
because you're going through a disease process that you don't know what the end will look like.
Yeah.
You only hope for the
Yeah.
best.
Yeah.
But when you have people supporting you,
Yeah.
it gives you more hope that you're going to get better.
Yeah.
Whether you get better or not,
Yes.
it has the way of repositioning your thought process.
Yes. Yeah. That support is very important because the whole cancer diagnosis, the whole process is just so lonely.
Yes,
It's
it is.
so lonely.
And very scary.
And very scary. Oh my
Very
God. You're
scary.
scared. The entire time my mom
Very
was going
scary.
through treatment, my heart is just like boom, boom.
What next?
Boom. What next? What next? You're so scared. You can't sleep. So it's just so many things going on.
And the toughest part, here in the United States, you go through a lot of labs.
Yeah.
At the beginning, it was much like running up and down from this lab center to that lab center.
Yeah,
This test, that test. You have to check this blood, check that levels,
Yeah.
because all that determines where gives the health team the determination to know if you are able to, your body can take cancer.
Yeah.
I mean, take chemotherapy,
Yeah.
because the chemo makes things worse.
Yeah.
So they have to be able to check you more frequently
Yeah.
to know that your body is in a at least in a normal stage or
Yeah.
average stage.
Yeah.
To be able to take chemotherapy, because chemo makes it worse. So if it's already worse, chemo gonna make it even more worst.
Yeah.
So you go through all series of tests like almost every day. Some days you get home and they call you back, oh, we have to recheck this again. We have to do another confirmation test. You're already tired, you're about to go to bed, and you receive that phone call.
Yeah.
your phone actually have to be. I have to change my I have to change my carrier.
Yeah.
Before I use a cheap carrier that even if you don't get me, it might at times you try to call me,
Yeah.
it will go straight to voicemail
Yeah.
because the network is not that much good.
Yeah.
But I have to change to a better network because
more reliable.
a more reliable network because I don't want to miss any call. I don't want to miss any call.
Oh,
so my phone is right on beside my pillow at
Yeah.
all times.
Yeah.
I have to be able to get all those calls.
Yeah.
So that support means a lot.
Yeah.
You're always on the go, always
Yeah.
on the go, always on the go.
Yeah.
From here to here, from here
Yeah.
to here.
Yeah.
At times you don't even have energy to go
Yeah.
to keep moving.
Yeah.
But let me tell you, one thing I realized is that when you're fighting for life, energy comes from nowhere.
Oh my God, the adrenaline. Adrenaline is your
It comes
fight
from
or
you
flight.
discover the strength that you never had.
Yes.
The strength that you don't even imagine that will ever come to you.
Sometimes you look back and say, who was that?
Yes.
You don't believe that was you.
Yes.
Yeah, that's your fight or flight.
Yes. Most people do better in difficulties.
Yeah.
And I think I'm one of them. I
Yeah.
get better in difficulties.
Yeah,
Under pressure I get better.
Performs under
Yes,
pressure.
yes.
All right.
Support is very important
Yeah.
for the loved ones. And another thing, speaking to the way it affects us as healthcare workers,
Yeah.
most people around you will not worry much because they think you know it all.
Yeah.
They think, oh, she knows, she's a nurse, she's a doctor, she's a medical professional, she knows more about this.
Yeah.
So they could care less of being there, talking to you, discussing it because they think you know it all.
Yeah.
The truth is that when it affects you,
your head doesn't work like a nurse.
your head doesn't work like a healthcare professional.
Yeah.
Things that you know, like biopsies. As a healthcare professional, biopsies takes a while. Biopsy is not an instant result.
Yeah.
But when you are the patient, right, you want it right away.
You want it right away. When
That,
the results back?
you don't believe that thing is doesn't. You don't believe that. Oh, you're like, oh, give me a break. That something can be done. I want result right now.
Yeah.
I don't believe it's 2 weeks. Why will it take 2 weeks?
Guys, so
even as a medical professional, you still need that somebody to tell you it's okay.
Yeah.
It's okay.
Yeah. So even if somebody's a medic,
yes,
just be there and support. Don't just assume they know everything.
Assume they know what to do.
Go out when it's your own.
You don't wait for your loved one to ask for this, for that.
Yeah.
It just comes up. You just want to be there because it makes you guys happy. It makes you guys keep going.
Yeah.
And you have those true friends. It might be 1, 2, but during these adversaries, that's when you know your true friends.
Yeah. You'd rather have 1 or 2 or 3 good friends who will stand by you no matter what than to have a bunch of spectators
waiting for your downfall.
Anyway, thank you guys. We'll see you in the next video. Bye.
Bye.